Good morning. It is Tuesday, October 4th. I'm Jessica Lovell. It is Pink Week, and today we are catching up with Kansas City's own Pink Warrior Dragon Boat team.
The sisterhood's probably one of the best parts of the whole dragon boating.
There are options when it comes to breast reconstruction, and how you train before and after can make all the difference. How this unique and athletic team is providing support for other women who are in the same boat. Do young, healthy people need the bivalent booster? Some experts say no. We'll hear what Dr. Hawkinson has to say about that. And thank you for joining us here on Facebook, YouTube, and on Twitter today. Welcome to the Morning Medical Update. Today, we catch up with the Kansas City Pink Warriors Dragon Boat team. This boat is filled with breast cancer patients and survivors, inspiring each other and rowing their way to better health. Plus, meet one of the doctors helping to rebuild their lives and cheer them on. Joining us this morning are two of our Pink Warriors, Jen Foreman-Wright and Cindy Mid-Gordon, along with their trainer, Kelsey Ingay at the University of Kansas Sports Medicine and Performance Center out there in Overland Park. So we welcome you all in. And then here with me in studio is Dr. Richard Corentager, Clinical Service Chief for Plastic Surgery and the Interim Clinical Service Chief for Physical Medicine and Rehabilitation. How are you?
I'm good. How are you?
Good. Good to see you. I love you in your pink. I love a good
Yes.
man in pink. Looks good today on you.
Well, that's what my wife does for me.
That's right. That's what she did her job today. We love, of course, getting all of your questions out there. So get those sent in to the links on your screen. And as always, you can post those in the chat below as we go along. Well, every year, more than 1 million women undergo a breast mastectomy and reconstruction for breast cancer. That includes many of the ladies of the Kansas City Dragon Boat team. They are taking to the water, offering support and hope to other breast cancer warriors.
I never would have dreamed it. I love it, and it was exactly what I needed in my life.
Betty Welch describes when she was first introduced to dragon boat racing. What is dragon boat racing, you ask? It's a canoe racing sport made up of a 20-person team, and yep, there's a dragon head out front.
You have a steer person in the back of the boat. You have a drummer in the front of the boat. You sit side by side. We paddle as a team. All of our movements are a team.
But this is no ordinary dragon boat team. These women have more than boating in common. They've all fought breast cancer, and Betty beat it twice.
I went in for my 5-year exam, which is your magic number, your happy visit. Going to plan a party. They did the 3D mammogram, and then they did the abyss, and that's what showed it.
Dr. Richard Corentager is a breast reconstruction surgeon at the University of Kansas Health System.
Whenever I'm working with women who've undergone treatment for breast cancer, and whether they've had mastectomies or what we would call reconstruction, they're getting them back into their normal activities, to their full activities. It is really critical.
I am so excited. The sisterhood's probably one of the best parts of the whole dragon boating.
When Michelle Stager was diagnosed with breast cancer, her need to fight back took over.
I was feeling feisty. I needed something in my life. I've had this newfound will to live.
Some of the women will have had radiation treatment, and so working those muscles, keeping the muscles as limber as possible, keeping their joints moving as much as possible, tremendously helpful.
This team is the first competitive dragon boat racing team in both Kansas or Missouri and has already competed in several races. They practice 1 hour, 3 times a week out here at Wyandotte County Lake. And practice is making perfect. And just a whole lot of fun for these Kansas City Pink Warriors, as they're called.
You just can get out there and you don't think about what you've been through. You just are moving forward.
I jumped completely in, and as they say, the dragon bit me, and I didn't turn back.
And Jen and Cindy join us this morning. Good morning, ladies. How are you?
Good morning. Doing well.
Good to see you. So we did that story right before the pandemic hit, and I know a lot has changed for the team. It's expanded, it's grown. Jen, let's start with you. Tell us a little bit about the accomplishments of the team just so far this year.
This year we've done quite a bit. So once getting back on the water in April, we have trained for attended and medaled in 4 festivals, and we have another one to come next weekend. That will be wrapping up our season. We have brought on 4 new active members, and with the help of our community and supporters, we have purchased our second boat, Casey Shine.
Wow, because right before the pandemic, you were getting your first boat. So now we're on boat number 2. That is fantastic news.
That's
I want
right.
to bring in Dr. Corantager. Dr. K, the ladies finally got you out on the water. So I want you to tell me exactly what it was like. Is it as easy as they make it look? I mean, were you able to hang with these gals?
So, it was really a wonderful experience
There
for
you
me.
are.
Yeah. So I grew up in Canada, so I was on the water canoeing constantly, and they had to teach me how to paddle, and they corrected my form. One of the things that I found most interesting is this is not something where they are just doing this for fun.
Yeah.
They are really serious competitors. And I can tell you that I was working real hard.
Look, I can see it.
And you can see me going there. And yeah, they would correct as I was going. But it's an incredible group, and it's really hard work.
It's something you've been wanting to do. I know you've been really excited about getting out there. So I was
Yes.
glad that we could finally make that happen. You guys reunited out there. Cindy, I think you sat with Dr. Corantager on the boat. How did he really do?
He did great. He kept
Awesome.
up. He did a really nice job with following the stroke.
Fantastic. Because it's not easy, Cindy. This is a sport. Again, this is not just out there. We know we're going to talk about the camaraderie of this team, but this is a sport. You are playing. You are playing to win.
That is true. We have found we are very competitive, all of us. We want to be out there and win.
So, Dr. Corantager, today we're talking about the different options for breast reconstruction and the role that exercise, like what the Dragon Boat ladies are doing. Tell us just what benefit does that type of exercise have post-reconstruction surgery, and possibly to prepare for it?
Well, anytime you're undergoing any sort of surgery or any sort of treatment, you want to be in the best physical shape that you can be. And, exercise, and especially sort of focused exercise in cases like this on the upper body are really important. So seeing them do this and the dedication that they show, as well as sort of the form that they have to have, it really works all of the muscles in the upper body, in the arms, and the chest. So this is just a wonderful thing.
When we think about breast reconstruction in the journey of breast cancer, we often think of that as the tail end, the last thing that maybe a woman thinks about. But at what point in the overall treatment plan should a woman actually think about reconstruction? Is that something to talk about with your doctors in the beginning stages?
Well, we've certainly through the Plastic Surgery Society, the American Society of Plastic Surgeons, we encourage everybody to have as much information as possible right from the very beginning, because that allows decisions to be made that are in the woman's, or in some cases the man's, in their best interest. So as early as possible, we think it's really critical.
So how has breast reconstruction procedures and options evolved over time? It's no longer one size fits all. There are different options for women, correct?
Yeah, it's continually evolving. We basically think of 2 broad groups: implant-based reconstruction, and then what we call autologous reconstruction, or reconstruction with your own tissues. We've got at University of Kansas, we've got an extremely active, one of the busier programs really in the nation for both implant and autologous reconstruction. Those most commonly come from taking tissue from the tummy, the inner thigh, and they can really be just so effective.
Why are they so much better than maybe what we've thought about before? And is it like a breast augmentation, maybe for people who don't understand? What is that?
Well, every time we do an operation as plastic surgeons, we're always trying to improve it. We're always trying to make it better. So when we look at the results that we're able to achieve now, they are just worlds ahead of where we were 15, 20, 30 years ago, and it continues to evolve. So breast reconstruction, we view it as a combination of a reconstruction and an aesthetic procedure.
Well, there was a new study finding that nipple-sparing mastectomy not only improves cosmetic outcomes, but can provide long-term cancer control. What does that mean, and why would that be?
Well, a nipple-sparing mastectomy is a tough operation, and we've got some tremendous breast surgical oncologists at KU who are able to do that. Not everybody can. When you do that kind of an operation, it leaves sort of the envelope of tissue along with the nipple and areola intact. So if one can do a reconstruction of the breast and sort of fill that envelope, whether it be with an implant, a tissue expander, or whether it be with your own tissues, that can really create some, really fabulous results.
So you're actually using an implant?
Sometimes it's going to be an implant, and then sometimes it will eventually be utilizing your own tissues.
So there was a recent study that was reported that says that breast implants can cause complication and in rare cases cancer. When people hear that, that's very concerning, but help us understand what that means.
So, breast implants and the implant-based reconstruction process, there are always risks of complications. Okay. And whenever you're using a foreign object, there are certain complication risks that you may not see when just using your own tissues. Now, when they talk about the cancer risk, what they're talking about is not breast cancer, and that's really important to differentiate. What they're talking about is cancer within the fiber tissue that surrounds the implant. It's extremely rare, but I think it is important for us to just have that conversation with women so that they can know what is going to be in their best interest.
I want to head back to our Pink Warriors today out at the Sports Performance Center in Overland Park today. And Cindy, tell us a little bit about when you were diagnosed and, of course, how you're doing today.
I retired from teaching elementary school in 2018, and a month later I fell and broke my foot. So when it was time for my normal mammogram, I couldn't do it. So I waited a month, and in November found out that I had invasive ductal carcinoma. It was stage 1, it was very early, and so a month later I had a lumpectomy followed by radiation. But it turned out I was beating myself up for not doing my mammogram on time, and it turned out to be really a blessing that it was just a little bit later, because my surgeon said if I had done it on time or if I had not had a 3D mammogram, that they wouldn't have found it, and then it would have been an entire year before it was discovered because it was too deep to find it on my own. So, a broken foot turned into a great thing. I had great medical care. I'm doing great today. I have developed lymphedema, but it's manageable. I still do what I want to do, and it certainly does not keep me from competing with Pink Warriors.
Dr. Cortager, on that note, what Cindy mentioned about missing or just putting off or delaying, which people do, that can happen with our mammograms. So let's talk about the importance of screening and early detection, and certainly when it comes to increasing better options for someone when they catch it early.
Right. Screening for breast cancer is, just as critical as it is screening for colon cancer or other things. And where we're fortunate enough to have an effective screening tool, such as a mammogram, we want to make sure that that all women have equal access and ability to get the mammogram and be treated as early as possible, because that always gives us the best chance for cure and also for the best reconstructive options.
Cindy, glad you got in and glad you caught that. Jen, tell us your story. When were you diagnosed and how are you doing today?
I was diagnosed in 2011. I am doing great today. Sorry, I had to think about dates here. So diagnosed in 2011 and was caught through a routine mammogram. I went in and I had not felt anything. The doctor had not felt anything. It was just a routine mammogram. And I was stage 2. I had a bilateral mastectomy and also developed lymphedema. I had chemo and had an unusual reaction to the chemotherapy, and that's what triggered the lymphedema. But that is well managed today, and I'm doing great.
Good to hear. Dr. Cortager, why do women develop lymphedema?
So lymphedema can develop as a result of the surgery that's done on the lymph nodes in the armpit. And one of the things, and I'm sort of pretty proud of this because my wife is involved with this.
Yes.
We have really a pretty unique lymphedema prevention program at KU, and they've demonstrated that they are able to see much lower rates of lymphedema than you have at other institutions.
Ladies, I want to show some video of you working out because this was actually, I think, 1 week out before COVID hit the Kansas City area. So how did the pandemic affect the team? You all were together and working out as a group there at the Sports Performance Center, but how did the pandemic affect this in your training?
So the pandemic hit a year into us being a team. So we had finally been able to get excited about planning a full season of festivals. We had come together as a more comprehensive team because we had that previous year to build, and then everything got canceled. But it was really important to us to stay cohesive, to stay a team, to continue to train and get on the water as much as possible, but we knew that we needed to do it safely. So we got into our 20-person boat with seats between us and alternating sides. So it was five paddlers, is that right? It was 5 paddlers instead of 20. And we were able to rotate in and out to do that and just stay safe and stay on the water in order to keep up our training.
Cindy, I just want to ask you, what has this team meant to you as far as the camaraderie with these women and your ability to keep your spirits up and help other women? What has this meant to you?
It has been a gigantic blessing. It is so great to be inspired by their journeys. And I'm 4 years out, but some people on the team, like Jen and others, are years ahead of me. And it's just very encouraging to see that you can continue, and that even when there is reoccurrence, sometimes that people still move past that. And just the sisterhood and being with a group of people who understand what you've been through without really having to talk about it or just to ask questions of, it's been invaluable. It's been a great blessing.
I know you ladies need to get to your workout here in just a bit, so hang tight. We're going to check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count and our headlines this morning. How are you?
Hi, good.
Hi.
Yeah. 31 active patients in the hospital with 3 in the ICU, 2 on the ventilator, 20 in that recovery period. So again, I've just kind of creeped up into that low 30s again. I don't think the story has changed nationally. Again, lower cases and hospitalizations, which is all a good thing. We continue to know and understand that the vast majority of the patients in the hospital continue to be unvaccinated or have not been up to date and have significant comorbid medical conditions as well.
Dr. Hawkinson, a doctor at Children's Hospital in Philadelphia says that healthy younger people may not need to get that bivalent booster, saying that the impact of the vaccine isn't that strong. What type of messaging is this?
Yeah, I think it's good. I think, it has become more detailed for sure. We always have to, number one, do no harm and assess the risks and benefits of everything we do. That includes for things like vaccines. Now, certainly when there was no immunity at all in the population, those vaccines benefits far outweighed any risks. We know that children are affected less when they get SARS-CoV-2 infection, but they still can be to some extent. And so getting those initial vaccines was vitally important. The bulk of our data, the best data provided, show that when you've had those 3 exposures to spike protein, whether it's 2 vaccines and an infection or 3 doses of vaccine, you have that good protection. You've developed that T and B cell immune response. He's been on several podcasts lately. I would invite anyone to go listen to either the ZDogg MD podcast or the TWIV, This Week in Virology podcast where he's on. He speaks very eloquently about that. Remember, he was one of the 2 people who did not vote for the actual booster compilation of the bivalent booster, but that is another detail and information there that he talks about. So it is very difficult to understand. I think for right now, understanding that there are risks and benefits, And his points are good. What is the clinical efficacy? What is the clinical benefit of giving these children now another dose? That information will be coming out, as will information and data about the new bivalent vaccines in that clinical real-world experience, hopefully near the end of October. But I think for this year, certainly I will give it to my children, at least my son. I know my daughter's recently had COVID-19, so she can really delay that booster dose. But he brings up very good points, and understand that a lot of the information that you see in those articles are about myocarditis, but the vaccine-induced myocarditis really is highest risk in those males aged, I think, like 16 to 24 or 29, but also that is a short-lived, self-resolving entity as well. So very good points, very difficult, a lot of details to talk about. I would encourage everybody to read exactly what he says, or go listen to those podcasts that he's been on to provide further information. But I think, at least for this year, I think it's important to understand that you can get that protection from the boosters. I will be giving it to my children, and then we'll see what happens in the next year, and see what all the data support and all the data say.
Dr. Hawkinson, scientists sounding the alarm over a sexually transmitted disease that causes infertility and has developed resistance to antibiotics. What do we know about this?
Yeah, so again, a lot of sexually transmitted infections can do that, especially we know that if you have those long ongoing infections that aren't diagnosed and treated. This particular one that they're talking about is a Mycoplasma Genitalium. It is a little bit different. Not many people have heard of that compared to things like chlamydia, gonorrhea, syphilis. It is very difficult to diagnose just because there is not readily available tests, but certainly probably we need to start testing for it more readily. In the United States, we know that in general, the number of STIs, or sexually transmitted infections, has increased for various reasons, and so it is very important to continue to roll out those public health initiatives to try and get access to people so they can get tested and get treated. I know certainly in my clinic, in my ID partners, we see a lot of patients on a weekly basis who have newly diagnosed sexually transmitted infections. So overall, that rate is increasing, not only for this one, but other ones as well. And I think it's, again, important to have those places of access so people can go get tested and get treated accordingly.
All right, do we have any reporter questions on the line today? All right, let's get to our community, and we are live today with the Kansas City Pink Warriors out at our Sports Performance Center in Overland Park. And Karen wants to know, and this is perfect timing, wants to know some of the exercises the Warriors do with their trainer and why they're so effective. So Kelsey, I'm going to let you show us and demonstrate with the ladies some of the things that you work with them on to get them ready for competition.
Certainly. So first of all, the Pink ladies are like in phenomenal shape. So this is going to be our 4th year going into training, and they do pretty much anything that I would have any other regular client do. Some of the things that I'm going to show you today are just kind of range of motion, because this is important at every step. So whether they're getting sore and tight from spending time on the boat, or whether you're earlier on in the process and still working on getting back range of motion after surgery or after treatment. So that's what I'm going to show you today, but I will say that these ladies, they do anything and everything that anybody else can do. They're in amazing shape. So what we're going to do today is we're going to use a foam roller. I'm going to have you ladies hold that end to end. And first we're just going to go side to side, and what you're doing is you're pushing kind of up on the bottom to try to get that extra range of motion through that shoulder, and then just kind of scoop through. Make sure you put that little extra pressure on the bottom of the foam roller, working on that range of motion. If you want to take this to more of a dynamic activity, like this is immediately just stretching, but you can get the legs into it. As all these ladies will tell you, paddling is not just in your arms, it is also from your legs, from your core. So these are good things to start out with before you end up doing the harder work that we do. Another one that we can do here, ladies, you're just going to hold that straight out front. You might be too close. And we're going to rotate side to side there. So kind of keep the knees soft, keep the hips forward, just stretching out your back, the upper back, working on that range of motion.
Kelsey, while you're working on some of those moves, Kelsey, while you're working out, I'm going to ask Dr. Korntager, just while you're doing some of that with the ladies, I'm going to ask you, Dr. Korntager, just when you see them doing these moves, how does that then help with those reconstruction options? For folks who are just joining us, we're talking about how exercise is so beneficial when it comes to reconstruction after the surgery and before. And just explain to people why doing this type of activity after a surgery is so helpful and really helps with the result.
Sure. So, after a surgery, there's going to be inflammation. There's going to be some scarring developing in and around muscles, potentially in and around joints if you're not moving those joints actively. So doing these range of motion, it actually helps with the healing process. It's been well shown that a little bit of stress on these tissues does improve the quality of the healing and improve the strength of the tissues that are healing.
Kelsey, how often do you work with the Warriors?
In off season, we work on Saturday mornings. So some of the ladies come in here and they do the stuff on their own with me throughout the year. But as a team, we get Saturday mornings in for 12 weeks. So this will be, like I said, this will be our 4th year doing this.
And you mentioned how good a shape they are in. We had a viewer question about what the average age, or what's the age range of the Warriors. And I know it's all ages. Can you ask the ladies for me? Maybe what's the youngest or what's the oldest? And
yeah, mid-20s to 70 is going to be the age range on the boat.
And if we could show that video, while you're doing that, I want to show a little bit of video for those who are just joining us to show them exactly what these women are training for. This dragon boat racing is an extremely extensive sport, and they train year round, and this is pretty intense stuff. And Dr. Korntager, you were out there with them. You can attest to how tough this is. This is not your weekend canoeing session. This is hardcore stuff, right?
Yeah, absolutely. And as I said earlier, they train to win. They're not just training, for fun, but these are serious athletes.
There you are. This is right before you. They got you in. They got you in, locked and loaded, ready to do it. And but yeah. So tell us, kind of when you're doing it. When you say they were showing you how to do it specifically, when we look at it, paddling's paddling, but you're saying it's a whole different ballgame.
Oh, it's a whole different ballgame, especially when you've got people behind and in front of you. Your arm has to be in a very specific way. They want your elbow moving and being held high. When I didn't do it correctly, I tended to splash the people behind me.
Look at you go.
And you can see, trying to keep up with them, it's
like a dance.
It really is. It's very carefully choreographed.
Were you sore the next day? Please say you were.
I would never admit to that.
I know you wouldn't. You could take it. All right, ladies, I'm going to let you keep exercising while I ask some more. I want to keep watching some of your stretches because they're good for all of us, but certainly women who have come out of any type of reconstruction surgery for breast cancer. So I'll let you go ahead and get back to your exercises, and we're gonna watch you while I ask some more community questions of Dr. Korntager. So please carry on. But I have a question. Megan remembers last week when Katie Couric announced that she had breast cancer. She found it early. That goes back to what Cindy was saying. She found it early, got her mammogram. But how important is it when somebody like that comes out, shows that they had early detection? How does it kind of move the needle, if you will, to make sure that people are getting those mammograms top of mind when you add in the celebrity factor, I suppose?
I think having the celebrity factor, the biggest benefit of that is it sort of takes it out of the shadows. Mm-hmm. So it's something that you're allowed to talk about. I think the other thing that it does is it helps to increase the visibility and the need for us to provide resources for all of the most vulnerable parts of our population who don't have normally access to early detection.
That's it. I think it's not just about making the appointment, it's being able to have access to the appointments, right?
Yes.
And transportation. There's so much to it. Heather said she read something called vampire breast lift. What in the world is this? It's a non-surgical breast augmentation?
Oh boy, we could go on for a while on that.
Go for it.
But it sort of comes from what used to be called, or what I guess some people still call, the vampire facelift, which was popularized by some celebrities. These are procedures where you take the individual's blood, and it is injected generally through a process called needling into the tissues. The idea behind it is that you're providing some factors which will increase your, improve the quality of the skin. It's not really anything like a breast augmentation. There's not a lot of science behind it, and there are definitely risks associated with doing something like that.
Okay, so it's not a popular option on the table.
Yeah, no, I'd say it's not in the mainstream of plastic surgery.
I think that's important. There's not a lot of science behind
Yeah.
it, and the risk factor.
Yeah.
Yes, okay, so we'll take that up. But thank you for answering that for Heather. That's a good question because I had never heard of that, but thank you for clearing that up. Right now you're watching our Kansas City Pink Warriors Dragon Boat team do their morning workout out at our Sports Performance Center in Overland Park. They race to win, and we've been talking about it all morning. All of these women have had breast cancer, many of them have had breast reconstruction. So not only are they out there supporting each other and other women in our community, but they're out there competing and really being an inspiration, but also staying healthy and taking control of their bodies. And as Kelsey had said, our trainer out there, these women are in great shape. And she's just helping them take them over that edge, get them to that competitive edge when they head out on that dragon boat. So we thank them for joining us today. And I just want to get some final thoughts from you, Dr. Korntager, and if we could maybe pull that video up of you again one more time. I can't get enough of that. I don't know why, watching you out there, right sandwiched in between all those women rowing away. So tell us what it's been like you're the one who first told me about this story, by the way. You said you've got to meet these women. They're really phenomenal. Many of them are your patients. And just what has this team meant to you to be a part of it?
You know, the thing that we all enter the medical field for is to see people, recover and to prevent disease. So seeing this group who has really thrived after what can be a really difficult diagnosis, it just gives you faith in everything, gives you the joy to want to continue.
I hear that a lot from doctors. Just anytime we're able to reunite our physicians with our patients, it's just always a really special moment to see them doing well. So thank you so much for being with us.
Thank you.
Your wife's going to be on with us this week for Pink Week.
I know. We're very excited.
I love it. Okay, and thank you so much. Always good to have you on. Dr. Hawkinson, final thoughts from you this morning.
Just the good questions about the boosters. I think it's relevant, and just understand there are other expert opinions out there right now. Again, the vaccine continues to be safe, very effective. We'll have new data about the administered bivalent vaccines going on, and also that data from those ongoing trials. So as soon as those are available, we'll report that to you. But again, if you are more in that high risk category, so that being age or other comorbid conditions, definitely recommended to be up to date with your booster. Go get those now. We have those available here at the health system as well.
All right, Dr. Hawkinson, thank you so much, and thank you for being with us today. Don't forget you can catch our updates anytime by logging back on to Facebook, YouTube, and Twitter. Did you know triple-negative breast cancer is diagnosed 3 times more in Black women than white women? Coming up tomorrow on Open Mics, did you know where you are born could also be a big factor? The science inside cancer cells. That is Wednesday at 8. Have a great Tuesday.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.